Hi everybody, welcome to the Age UK Lancashire podcast. This is a short introduction for you just to get things started, and I'd like to introduce myself and tell you all a little bit about this podcast. I'm Lyn Hutton and I'm very lucky to be working for Age UK Lancashire as their Dementia Services Manager. I began the role in September last year and I'm really excited about the future of dementia services across the county. I'll tell you a little bit about my background so that you can really get to know me. I began my career at the very young age of 17 in mental health nursing. At 17, I knew very little about anything, let alone nursing, so when I started the training, it was at the Lancaster Moor Hospital, which was the old asylum years back, and I was really shell-shocked, to say the least. We didn't talk about dementia as such. We talked about the elderly ladies' ward or the men's ward, for example, and the care was very, very different then. I'm really proud to be part of the changes that have occurred over the years to bring us to where we are today. So care then, when I was 17, it was literally providing the basic needs of warmth, food, cleanliness, but there was no thought really about dignity, about social interaction, about person-centred care. There was nothing like that. I remember we got a new charge nurse one day who said he wanted to change the way we worked so that the privacy and the dignity of each of our patients was at the forefront of care. The staff were up in arms with this. They thought his suggestion was ridiculous. They had no time, they said, to do things differently. There was no need to change. And looking back on those times as a young woman, I remember that charge nurse. He changed my outlook on what I was doing and why. I still strive towards improving care today. We thought we were doing the best. I do believe that, but there's always room for improvement when it comes to care and support of people with dementia and the families. I've got such a lot of stories throughout my years delivering dementia services that I've gathered, and I can't wait to share those with you and hopefully find some really interesting speakers and other people who've been through the same, and they can share their stories too. After I qualified, I travelled and I worked in New Zealand and Australia. I carried out some different jobs as well, so I went into a little bit of quality assurance, administration, and even worked in a bank in New Zealand. But I always came back to nursing and always for our older citizens with dementia. Now I've returned to Lancashire, and it's a bit of a full circle moment in time really for me. So I was born and raised here, and now I'm back here. And I feel this is my time to bring all I've learnt, all my experience, all my passion for dementia care home to the people who raised me. As well as being a dementia professional, I'm also a carer for my own mum who has a diagnosis. She's doing really well. She's managing at home and she has some care support going in. Really, I think she's, as she puts it, she's not sure about this dementia thing. She doesn't like to accept it, and she doesn't really believe she actually has it. Her main thing is a short-term memory. That's the thing that bothers her the most. So my mum's name is Eileen. I've asked her, and she's happy for me to talk about our journey, and I'm hoping that one day I'll get to introduce you to her. She's a real character, and the thing that I value most is that she and I share such a lot of humour. We are a bit wicked at times, and she says we should be on the stage, but I'm quite concerned about what she might say if she was on the stage. But anyway, who knows? One day we just might be. I also lost two of my aunties to dementia, one with Alzheimer's, one with Parkinson's type, and they were beautiful ladies, both of them. I wouldn't think there'd be many people today who don't have somebody close to them with dementia, or have a friend of a friend, a neighbour, an acquaintance with it. Now let's just talk about the podcast. People need information, especially when dealing with dementia. It's overwhelming. It's worrying about memory loss, whether that means you've got dementia, to understanding exactly what dementia is. And the problem is there's so much information out there and it's hard to know where to start. So this podcast is being brought to you to help you to navigate your way through the journey of dementia. And each episode will bring practical guidance on what to do, where to turn, how to manage, finding the positives and living well with dementia. We want to start right from the beginning of the journey, when you might have a little bit of memory loss or know someone who does. And, automatically we begin to think, wow, this must be dementia. This doesn't seem right to me. So that's where we'll start, and then we'll go right through and talk about everything. There'll be some guests and at some stage videos to demonstrate practical solutions, and we'll signpost from the podcast to areas of support and further information. We will make sure that there's something to take away from each of the series, and we can deliver content in a way that's understandable and accessible to all, whether you're a person with dementia, a family member or a carer, because I think part of the hard thing about dementia is, there's a lot of information about the disease, about how it manifests, about how it looks within the brain, but as a person with dementia or a carer for a person with dementia, you want the practical. You just want to know, in layman's terms, what's happening, why, what can we do? So I'm really looking forward to simplifying the bewilderment of dementia. Age UK Lancashire does aim to work alongside our colleagues such as Alzheimer's Society, Age Concern, community groups, etc., because we don't want to be all working separately. We want one place where you can go and access all the support you might need from whoever is going to deliver it best for you. So the team at Age UK Lancashire is amazing, and together I know we'll do our very best to make a difference to those living with dementia and their families and carers. I am really lucky. This is my dream job, and I'm lucky that Age UK Lancashire have given me this opportunity, and I'm so eager to see what we can achieve. Thank you so much for listening. Take care of each other and stay strong. Much love, Lyn.
For more information on dementia services or any of the other services that we provide across Lancashire, please visit ageuklancs.org.uk. Thank you for listening to Age UK Lancashire's Dementia podcast. We really hope you enjoy it, and we really hope that you will get all the help and information you need from the future ones. Age UK Lancashire is a registered charity in the UK. We don't get any support from the government. We rely on funds from the public, from local businesses, and from local grants and trusts. If you would like to make a donation today, please visit www.ageuklancs.org.uk. Your donation will make a huge difference to our work, and it means that we will be able to support local older people and give them the help and the support that they need. Thank you very much.